Well, we've all felt the impact of COVID-19, but one community hit especially hard is the LGBTQ plus community. 13 Action News reporter Austin Carter explains why and has more on the effort to provide resources.
A new Harvard study with the Movement Advancement Project shows that COVID-19 has negatively impacted LGBTQ households more than non-LGBTQ households, especially if they are Black or Latinx.
There tends to be worse health outcomes in general. Part of that is because of a lack of primary care. So people often in this community, particularly the transgender community, don't already have established relationships with medical providers.
Healthcare workers say they are seeing these study results reflected in the community.
They would rather skip their medical appointments than have to come out and expose themselves to COVID. So yeah, it is definitely having an impact. And then if you can't come in for your doctor's appointments, if we can't follow up, it's hard to make sure that we can refill your medications and everything and still stay safe.
The study says 64% of LGBTQ households have lost a job due to the pandemic. And if you're Black, that number is 95% compared to less than half of non-LGBTQ households. A quarter of LGBTQ households couldn't get needed prescriptions. The stats go on and on. Experts say the providers who are inclusive of LGBTQ people need more support to make these stats go down.
They run on government dollars, they run on grants. And if your starting point is, well, these people don't really exist, then we're not getting the same level of funding either, which means we're just getting the short end of the stick at all angles.
I'm Austin Carter, 13 Action News.